Hello, good morning. Welcome to the parent share session for PASIP. And today we'd like to welcome Healthwatch, who are joining us to tell us about what they do in Windsor and Maidenhead. And we've got Kerry who's joining us. Morning, Kerry.
Hi, good morning. Thank you for letting me come along and tell you a bit about Healthwatch. I've just got a short presentation, so I'll just go through that now. So my name's Kerry. I'm the Healthwatch officer for Windsor, Ascot and Maidenhead, and I also lead on research projects across the whole of East Berkshire as well. I've got a short video here just to it's about 2 minutes long. It'll just explain what Healthwatch is, what we do, things like that, and then I'll explain it in a bit more detail as well.
To help make health. Our job at Healthwatch is simple. We're here to help make health and social care work better for you. Who do we mean by you? We mean you if you or a loved one think you'll need an appointment with your GP, help to find the right care home or self-help group, access support for your mental health, or need access to any other health and social care service, hospital, care centre, NHS dentist, pharmacy or home care services, at some point in your lives. Healthwatch is the independent champion for people who use health and social care services. Our purpose is to find out what matters to you and to help make sure your views shape the support you need. It's our job to listen to people's experiences, sharing their views with those who can do something about it. That's right. We have the power to ensure that the government and those running the services hear what you think and take action based on people's needs. Another part of our mission is to point you in the direction of the right services. So if you're facing a difficult health decision or just don't know how to find out about what support options are available, we're here. Actually, we're here, and here, and here, and here, and here. We have branches in every area of England. So help make services better in your community. Share your thoughts and experiences with us. And if you have a question, why not get in touch? We're here to make care better for you.
There we
That's
go.
Brilliant, Kerry. What a great video.
Yeah, it's just on YouTube, so anyone can sort of watch it and access it. We always get a lot of good feedback about that video. So I think it's a very good one to use. Even though the videos just explain this, I'll just go over it in a bit more detail. So Healthwatch are the independent champions for people in local communities who use health and social care services. So we're here to make sure that the people who are running those services put people at the heart of the care. Our sole purpose is to understand the needs, experiences and concerns of people who use these health and social care services, and we speak out on their behalf. We're focused on ensuring that people's worries and concerns about how current services are being run are addressed. And by using all this feedback and this information, we're able to work to get the services right for the future. So the main things that we do, we do a lot of things, but these are the main two. We gather the views and experiences to influence change so that we can get better health and social care services. And we also provide information, advice and signposting. This is through our Healthwatch Hub. I've got the contact details for them in a later slide. But just to sort of explain the Healthwatch Hub a bit more, you can ring them between 10 and 4, Monday to Friday. The calls don't cost to ring this number. And you'll get through to our lovely Healthwatch Hub team. They're all very friendly. If you've got sort of any queries about, you want to tell someone about your experience that you've had at a local service, or if you know that you want to access a service but you're not sure where your local one is, or if you've got a few local ones but you're not sure exactly which one would be best for you, we can sort of advise you in that sense to get the best option for you and give you more choice and control over the services that you use. So we hold services providers and commissioners to account. We report on key issues and contact providers with advice and recommendations, and they don't have to agree with our recommendations, but they do have to publicly tell us what they're going to do in response to our advice. So an example of this is what Healthwatch do quite a lot of, not at the moment because of the pandemic, but we run a few enter and view projects. So this is where we will go into a service. So for example, we've done a few at care homes. We might go to a hospital department, we might go to a GP surgery, we'll enter the service and we'll view it. It's not so much an audit. We don't, although we are, looking at what can be improved, we are also looking at what is already doing so well, so that we can take that as best practice, so that if a similar service in another location needs that area improving, then we can sort of transfer the methods that way. Obviously, we're not able to do the enter and views at the moment. We have done a few virtual visits. These were, they were done last year, so in 2020, just as the pandemic was settling in pretty much. And it consisted of, so it was at care homes, and it consisted of surveys to the residents, their friends and their family. But also we had, like, the managers and the staff in the care home would have sort of iPad devices, and they would show us, basically take us on a tour of the facilities, and also leave the devices in a room so that we could have private conversations with the residents and their friends and family as well. So once we do projects like that, we will write a report. At the end of the report, we'll make a couple of recommendations, and then we'll then give the provider a chance to respond to those recommendations if they want to. They don't necessarily have to, but if we don't receive a response from the provider, then we have to sort of say in the report that we haven't received anything, although they are aware of the report. So this is Team East Berkshire. So we have Raf, who is the East Berkshire manager. So he's sort of oversees my team. Megan, she's the Healthwatch officer for Bracknell Forest, and she also leads on the volunteers across the all of East Berkshire. Myself in the middle, so I'm the Healthwatch officer for Windsor, Ascot and Maidenhead, and I also lead on research projects in all of East Berkshire. And then Chaya, who is the Healthwatch officer for Slough, and she leads on communication and engagement. So the three of us sort of have two roles combined into one. So we'll oversee our own area, but also have our specialism, which we do across all of East Berkshire. So our job specifically, so we find out what's going on in health and social care services across East Berkshire. We will gather evidence about real experiences, and these experiences will be good or bad experiences. We'll gather this data under normal circumstances. We would go out physically and perhaps set up a stall outside a GP surgery. As people are walking in and out, we'll gather feedback that way. But at the moment, we're relying quite heavily on anything posted on social media, anything reported to Healthwatch Hub, anything put on Care Opinion, and also our What Matters Most campaign as well, and I'll explain a bit more about that in a second. We provide evidence-based feedback to commissioners and service providers to influence and to challenge. So this is similar to the enter and view projects, and we'll also, evidence-based feedback is basically anything we hear from the first bullet point. And so we speak out, challenge poor practice and help turn it into good practice. And we signpost people to services using the Healthwatch Hub where possible. So our hashtag What Matters Most campaign, so this is our most recent campaign, and it's actually the first one of this year. So as a newly formed Healthwatch service within East Berkshire, we need a good foundation of information from communities. And so for those of you who aren't aware, the current Healthwatch team, we won the tender for it in January. So we've only sort of had control of the Healthwatch service since I think it was January 2nd. And so our team's quite new, we're quite a baby team. And because of that, we need to find out about the local community, what services are being used, what people think of these services, for example. So to do this, we published a survey, which you may have seen on our website, our social media, in newsletters, things like that. This is to help us understand and gather evidence about what matters most to local communities in relation to their health and social care services. So we wanted to find out which health and social care services people have accessed in the past year. We then also asked participants to rate these services as excellent, good, okay, or poor. We asked if participants have had any positive experiences. We asked which services residents felt need improving. And we also asked what health and wellbeing goals people have for the next year and what support or help, if any, they need to achieve those goals. So the survey closed on the 4th of May, so just last week. So myself and my team are very busy analysing all the responses. We had, I think it was 513 responses overall, and 240 of those actually came from the WAM area. Our findings will be published in June. So this week we'll be finishing the analysis. The next 2 weeks we'll be writing reports. There'll be one report for each of the localities. So 3 reports in total, and then these will be published in June. So they'll be published on our website, they'll be put in our newsletter, and we'll announce when it's ready to view on our social media as well. And I've just got some notes here which I can chat through with you. Just some results basically. So although it's not been published yet, I'll let you guys know what we're seeing so far. So just from the first question about what health and social care services people have accessed in the past year, the highest rated services in the WAM area, so this is in order. So number 1 was the COVID vaccination programme. Number 2 was the ambulance services. Number 3 was non-COVID vaccinations. Number 4 was pharmacy. And number 5 was opticians. So they're the highest rated services in WAM. And then the lowest rated services, so right at the bottom is the residential care and nursing home. That was followed by children's mental health services, then adult mental health services, and then adult social care. So just with that one question, we can see, the good practice from the highest rated services, and then we can look at the organisation and efficiency of those services and how we can then use that to improve the lowest rated services. And then that also gives us an idea of where Healthwatch East Berkshire can focus our priorities for the next year as well. Yeah, that's my results so far. So if that's of interest, there'll be more to read in June, and yeah, there'll be more to read in June. So we also, with Healthwatch, offer volunteering opportunities. So at the moment, these are quite limited just because of the pandemic, but opportunities that we will have coming soon. So you can get involved with some enter and view projects. So when we have a project sort of approved to go ahead to view, a GP surgery, for example, our volunteers can actually be the people who go in to the service and view it themselves. They can, speak to people using the service, and then feed that information back to us. We can also offer research opportunities as well if people would prefer to work on their survey writing skills or even analysis skills, things like that. We can offer that too. Mystery shopping, so this will be where so other health watchers have done this before, where they've got a website that they're using. It might be for a specific service, and then they want to find out specific information. So it's how easy it is to access that information. And then we will also do that in terms of different of people with different case studies as well. So, we might get people of varying ages, for example, males, females, different case studies, and just see how easy it is for different people, different diverse people to access that information. A big opportunity with us is collecting views and experiences. So this is something that people are able to do now. This is what our current volunteers are doing. They're just speaking to their friends, family, their local community, collecting views that they have from health and social services, any experiences they have, and reporting that back to us. And we can then pass that on to the service provider. Obviously, volunteering gives you the opportunity to give back to your community. Provide a young person's view. You can also gain insight into the health sector. So, a very good example of this is several years ago when I was doing my undergraduate degree, I actually volunteered with Healthwatch, and now I'm employed by Healthwatch. So it definitely adds to your CV and, for future careers and everything. If I'm not a good example of that, I don't know what is. So if anyone is interested in volunteering, I've just put Megan's email at the bottom there. There'll be a few forms to fill out, DBS checks, things like that. And there's no commitment. If people sort of want to dip in and out of volunteering opportunities, that's absolutely fine. And then finally, I've just got our contact information. Oops. So the contact information, so I've got my email first. So, contact me with anything, I'll be happy to answer. If anyone wants to sort of arrange a private one-to-one and speak about an experience that they've had, that's absolutely fine. Or if there's sort of, feedback or experiences that you've heard of through the grapevine and you want to speak about them to me, that's absolutely fine. Then we've got the Healthwatch Hub. So this email address here, the info@healthwatchwam.co.uk, that will go to the Healthwatch Hub, but I also have access to that inbox as well. So I can also see anything that comes through there, and anything that I think is especially relevant to me, they'll also forward to my personal email account too. And we've got the Healthwatch contact number. So like I said, between 10 and 4 p.m, Monday to Friday, you'll get through to our lovely Healthwatch Hub team, and the number is free to call as well. And then we've got the link for our newsletter. If anyone wants to sign up to that, it's a monthly newsletter and it comes out around the 15th of the month. Unless it falls on a weekend, then it might be either side of that. If you sign up to the WAM newsletter, you'll get you'll get Healthwatch news, local WAM news, and then other health news. They're basically the three sections of it. And then we've got we're on social media as well. So we've got our Facebook, Twitter, and Instagram. I've said I'm happy for these slides to be sent out as well to everyone so that you can just sort of click on the link and make it a bit easier. But the social media is quite easy to remember. It's just Healthwatch WAM on all three sites. There's no sort of change between them, just Healthwatch WAM. So thank you for letting me come along today and just explain a bit more about Healthwatch. I'll stop sharing my screen and just see if there's any questions.
That's brilliant. Thank you, Kerry. That was really useful. I didn't know, I've been working in this industry for a long time and I didn't know all of that, so I really appreciate it. And I was pleased that you were able to get some of those high level results back for Windsor and Maidenhead, because I mean, I actually agree with how it came out, because the COVID vaccination centres have been amazing.
Yeah.
Just such great teams. Great to think that all those people are volunteering and
yeah, we've had a lot of so where people can speak about their positive experience. When it comes to anyone mentioning the COVID vaccination centres, they've just said how amazing the staff are, whether they're paid or unpaid volunteering, and just how well organised and efficient it is, and how much it put them at ease as well.
Yeah, I've got a son who was very anxious about having his vaccine, and he's 19, and they went above and beyond. Like, they took him into a private room so that he wasn't involved with, like, because they can be quite loud and he doesn't like loud noises, and took extra time explaining it all to him. And so, I mean, I couldn't thank them enough. I felt like crying at the end of it, because it felt like such a big mountain to get him to have the vaccine, and then he did it, and it was really a nice experience,
Yeah, definitely. And then good experiences get passed on to others, they speak about good experiences, and then it sort of encourages more people, because more people feel comfortable with it.
Yeah, no, it's been really good. But and also didn't surprise me, the bottom ones about residential care, adult mental health and adult social care.
Yeah, so obviously that will give us, I mean, one of the questions did ask what people think our Healthwatch priority should be going forward, but I feel like that question in itself tells us enough that because obviously with our enter and view projects, we can look at doing more of those in residential care and nursing homes, and just seeing, getting an idea of what people, like why people rated it so poorly, basically. And then obviously the mental health services for both adult and children, that's actually quite interesting, because although we had 240 responses for the WAM area, not many of those were actually young people. So it's the fact that the adults themselves are also picking up on the fact that children's mental health services, they also need improving.
I would imagine it's probably the adult replying about that for their child, because we hear a lot of that, and that's one of the things that is one of our priorities. PACIP is to improve the mental health services for children, because the wait time is very long. People tell us that when they do finally get seen, the service can be really good, but they've taken 2 or 3 years to get to that point of being seen. And sometimes they get to that point of being seen, and then they're told, you don't meet the criteria, come back in 6 months, and you're like, I just, so we're also doing quite a lot of work on that. And one of the things that perhaps PACIP and Healthwatch can work together on is that we could perhaps ask parents to contact you with, like, their journey through the mental health system.
Yeah, definitely.
Because there will be good and bad, but unfortunately, there's times when I feel sorry for the clinicians that work for CAMHS, because they're not out there to do a bad job. They're just underfunded, and there's not enough of them to do what they need to do. So I think the neurodiversity pathway for autism, ADHD is nationally going through a lot of developments.
Yeah, definitely.
So however we can, because that was one of my questions actually, was how, when you have this information about services that you want to make as your priority, how do you then work with, like, WAM health professionals to then give them feedback and improve those outcomes?
Yeah, so we regularly sit on board meetings, so whether that's the Health and Wellbeing Board or even CCGs. And even yesterday, for example, the East Berkshire team had a meeting with the CQC. So we'll have those meetings. At the moment, we're having them sort of every 6 weeks. So the next time we have the meeting, the report all our findings will be finalised, and we can go from there. So we have someone who represents yesterday we had someone from dental, primary care, hospitals, adult social care, and then going forward we want to have more people on included in those meetings, So in the next one, we want to have someone to represent mental health as well, because that was a big finding of ours. I mean, we haven't even finished the analysis yet, and that's come up a lot. So has access to GP services as well, obviously because of the COVID pandemic. But yeah, that's what we'll take those findings, and also anywhere that's specifically named as well. So anyone that's named a GP surgery, for example, we'll contact them and say, you know, we've published this report. We have had feedback about you. If you want to read through, if you want to arrange a meeting, we can discuss this further and just go from there. But yeah, it's just sort of once we've got the report, just having meetings upon meetings basically until we can improve this. And then obviously if any specific service says that they, you know, would like to go ahead with an interim view, we can do that, because we are independent of the NHS. So we're not sort of involved with them at all. We do work with them, but like I said, people don't have to take on our recommendations. The interim views, they're not an audit either. It's just to help the services, basically, to give them advice on how they can better the services for the people who are using the services.
Yeah, and I think hospitals, you know, like say for example children's wards and children's outpatient wards, I think you know, I think there would be families that represent PASIP that would be keen to give you their feedback as well, because they can be quite scary places.
Yeah, definitely.
We've had feedback in the past about, especially around when your child becomes an adult, so they might turn 18, for example, but they are actually still you know, a child because of their developmental age. And we've had feedback that as soon as they become an adult, the parent's not even allowed to be on the ward, for example.
Yeah.
That's really hard when you're a parent of a child with additional needs. They will need you there. So that's the sort of feedback I think we'd be really keen to work with you to, you know, and I know in the past that's happened with an East Berkshire hospital actually, and just by talking to a sister on the ward, we were able to make those changes.
Yeah.
It was just that the staff that they met at the beginning of the, you know, and, you know, signing them in, registering them, said, oh no, you can't possibly be here, you know. And what you hope is that by giving people that feedback, the next family that have to have that, it'll be a better experience for them.
Exactly, yeah. So that's why, you know, we encourage to hear about experiences, whether that's good or not so good, because we, you know, we do want to improve the services, if not for the present, then at least for the future. So even if it's you know, already happened for, like you said, like the present family, we can at least work to improve it so that that doesn't happen again for the next family that comes along. And another thing that we're looking at within the survey is whether people, because we've noticed as we're going through that a few people have mentioned that you know, they've answered on behalf of their son or behalf of someone that they're caring for. So we're also in the report going to include, so we'll include the analysis of everything, but then we'll also say that specifically with those who have answered as parents and carers, these are issues that have come up for them as well, and these are the good things that have come up for them. So then we want to see more of this and we want to see less of this, and just go from there.
Yeah, that sounds really beneficial, because I think as parents and carers you feel like you're sometimes it's an uphill battle, because you've not only got to get their health right, you've also got to get their education right, their social care, and it feels sometimes like you're a project manager of your own child, because there's so many different pieces, you know, of the pie. Did therapies come up in the survey at all, Kerry?
A few times they did. I'm trying to think back. So I was doing that question yesterday. So specifically, there were specific mentions of mental health. CAMS did come up a few times as well. Talking therapies, there was a few positive experiences with that. But again, it's a case of there's a long waiting list, but once you have access to it, it's a great service. So it's the same issue. It's the access basically that's coming up a lot, whether it's for mental health services, whether it's for GP, even surgeries that have been pushed back because of COVID. It's having that access to have it done again.
We hear a lot from our families that therapies can be quite hard to access. So for example, one of the therapies is sensory therapy. So that would be accessed through an occupational therapist. Currently the NHS don't commission sensory therapy for families that have got children that have got sensory processing disorder, and that can be quite that's about the environment around them and how the child deals with it. So for example, that could be their ability to be in a room with, you know, really bright lights, noise, and also, you know, a child not being able to do a task because they need to move about and they need to work their core muscles. And so we've actually done quite a lot of work around sensory. Well, we've done a presentation about sensory therapy because we feel it's really important. But I just wondered if that had come up at all in this.
I haven't seen any specific mentions of sensory therapy, but we are the analysis is still ongoing. So the questions that I have left for the WAM area to analyse are going through the poor experiences. I need to finish that question. I need to carry on with the what help and support people need to achieve their goals. And then also the final question was if there are any further comments. So that question is always quite a tough one to analyse because people can just mention anything else basically. So it's hard to sort of put those answers into categories. So obviously once I've done the poor experience question, I'll sort of have a better idea, because at the moment I've just sort of got all the positive stuff in my head.
That's good too.
So I was thinking I'll leave the poor experience question for Friday, because then at least if it does feel a bit sort of, I don't know, if it does get to me a bit, then at least I've got the weekend.
Exactly. That Health Hub number that you gave us, the Healthwatch Hub team number, is that a national number then that people can?
So that number is not for all health watches. So at the end of the YouTube video, there's another number on there. So I think that's the national number. But the one that I included at the end, that's for our specific Healthwatch Hub. So our Healthwatch Hub covers, I'm gonna forget one of the areas, but it's Healthwatch East Berkshire, Hampshire, West Sussex, Wokingham. I think that's it, but I'm probably forgetting one. But that sort of area, just because we're all managed by the same senior team. So we have our specific Healthwatch Hub. So anything that we get on there, I actually do the insight reports, which are a monthly report. So at the beginning of each month, I'll look back at all the feedback we've had from the previous month, report that, and then we can send that to external stakeholders as well. But the Healthwatch Hub will also action any feedback as well. And they're all trained with safeguarding too. So if anything comes up that is a cause for concern, it'll be passed on to a relevant person and dealt with as soon as possible.
Brilliant. Well, we'll definitely help advertise that service, because it might be something that people aren't aware of, which is why we wanted you to come on and speak today. So really appreciate it. I think I've one of the questions I had, but you kind of answered it now, is what has been the main issue you've heard about with children? But I think you've sort of covered that as the mental health service.
So I would say mental health service, specifically for WAM. I mean, I don't think I do have the other results here. Let me just have a look. Children's mental health was also one of the lowest in Bracknell Forest and Slough, so across the East Berkshire. It's actually the lowest in Slough. So it's definitely something for us to look at across all areas. But also in Bracknell Forest, so we've got children's mental health is appearing in the lowest 5, but also elderly care appears in the lowest 5 as well. So it's a real mixture across the 3 areas. We did have some key themes appearing from the positive experiences in WAM as well.
Yeah.
So COVID vaccine at Maidenhead Town Hall and Windsor Racecourse, they have been mentioned so many times as being excellent. So well done to all those volunteers and everyone working there. And also blood tests at King Edward VII Hospital. That's had a few mentions as well of being easy to access, easy to book, and really efficient when people get there as well. So that was quite surprising that one specific test at a specific hospital has been mentioned. But it's things like that we're looking out for. So, you know, because blood tests at GP services, for example, may not get as positive feedback as we did with that service. So it will be looking at why that service is doing so well, taking that good practice and moving it into other services as well.
That's interesting, because I know from talking to another parent in Windsor Maidenhead who'd had a bad experience, and they had said that the blood test needed to be done at the person's home because the child wouldn't go to the centre. The centre didn't understand that the child's needs were so great that wouldn't happen. So that, and I know from my own personal experience that if you have a really good play therapist at the appointment, it can make all the difference, you know, with an iPad and bubbles and distraction, you know, really helps. So that's good. I think we need to perhaps remember to use your service more than we are at the moment, because I think we take the feedback in and we're presenting it to the local authority. So for example, like the DCO, the District Commissioner Officer, who commissions the services, but we're also, if we let you know, because I would imagine, like our service, the more you hear about one particular service, the more strength you have to then give the feedback, I would imagine.
Yeah, so this is what we were talking about in our meeting yesterday with the CQC. One of my colleagues, Chaya, she's had a few meetings with one of the CQC managers, one of the sort of inspectors, and mentioned a specific GP service and the feedback she's received, because she goes to quite a few sort of feedback forums, and this one service came up quite a lot. And in the meeting yesterday, the representative from the CQC sort of said, well, you know, I haven't heard anything else, so, you know, what do we need to do, sort of thing. And Chaya was just like, I have heard a lot more. So just us getting that feedback gives us the power to make better change happen. Because if things aren't reported, then things won't improve. Exactly. But it can be as easy as, you know, a phone call, even an email. And we do have an online form on our website as well, but I feel like people, just from reading the feedback, people prefer to email in. But it is, you know, it can take less than 5 minutes of your day just to sort of type out the experience. And anyone that sort of does give us feedback and tell us about their experiences, we do recommend, obviously, if people feel comfortable telling us the name of the service and just as much information as possible, because that's something we found with our survey is when people are telling us about their good experiences, they're like, you know, they'll say something, I got through on the telephone really quickly. It's like, you know, that's really great. It's, you know, we know now that people value being able to contact the services, but we don't know specifically what service that person was trying to contact. So we don't know which service is answering the phone quick enough. So it's things like that, just including enough detail so that we can take that feedback and move it forward.
Yeah, agreed. It needs to be specific, doesn't it? And measurable, so that you can do something with it.
Yeah, definitely.
Oh no, it's really interesting. That's the only questions I had. I'm really looking forward to seeing the survey results. I'll make sure I sign up so that I get them immediately, and I will encourage our members to sign up as well.
Yeah, that would be great.
And you're welcome at any time to come and sometimes it might be useful for you just to like drop into our sessions.
Yeah, definitely.
Especially when they're physical and we can have a cup of tea together.
Yeah.
At least then you can hear what people are having. I think sometimes, I don't like you using the word journey, but you hearing a parental journey about how many appointments parents have to do, like literally their diary can be full of medical appointments.
Yeah.
How distressing that is for the parent and for the child. And one of the things that I'm really passionate about is parents having to tell, each time they meet a new professional, tell their story again.
Yeah.
And sometimes those doctors or medical professionals have got those notes that they could read upon, and they could be a little bit more proactive in saying, I've read what's going on.
Yeah, we did get a few mentions of that as well, and that's without me having even looked at the poor experiences. People have just sort of mentioned, the service is great, but this could be slightly better, or it would be better if I didn't have to explain myself every single time I saw a new person at a different appointment. So definitely, and especially when people having to be transferred to a different hospital or a different department, the medical notes are all there, but you just have to explain yourself again, sort of thing.
Yeah, and you mentioned being transferred. That's another big issue, I think, for our families, is that the transition between children to adults is a real challenge. The services are so different.
Yeah.
And it can be, parents tell us it's like dropping off a cliff, because all of a sudden you leave what you knew and then you have to move to the adult service, and it's so different.
Yeah.
For example, my son, we've had the same paediatrician for like 18 years. We move over to adult services and we don't get a named doctor to go to. We're just seen by the adult service team.
Yeah.
That's really hard, because you think, how will they know?
Yeah, because people like regularity. People like to know what to expect. It can be scary enough for people to have to go to the hospital or whichever health and social care service. But just knowing that you're going to have to see the same person again, that is comforting to people. So that's definitely, again, something that was mentioned.
Yeah. That's brilliant. Thank you so much, Kerry, for your time. I know Way's in the background. I just wanted to check that Way didn't have any other questions that she wanted to ask. Oh, she said thanks so much. And we'll look forward to having you come on again.
Yeah, that's great. And I'll email over the presentation so that it can be sent out to anyone. And then once the report's ready, it will be we'll post on our social media and in our newsletter that is ready to read, and you can read it in your spare time.
Yeah, brilliant. Thanks, Kerry. Nice to meet you.
Nice to meet you too. Thank you for having me.
Thanks. Bye.
Thanks. Bye.
Bye.